Hey, good afternoon, everybody. It's Friday the 13th, another summer day, and we have a special guest, it's been with us several times. Sonny Rama is going to be with us. He's Vice President of Development and Innovation at the VNA Healthcare. So we're going to bring up Sonny now. And Sonny's a good brother here, and we're gonna share about what's happening with the VNA out there in the community. Uh, Sonny, good to have you with me again.
John, thank you for having me. Good afternoon. Always a pleasure to connect with you for a little bit each and every week.
Yeah, this latter part of the week here. I want you to you were, before we got online here, you were discussing several of the upcoming things that you're doing with the vaccinations. We're trying to get everybody out there to get that vaccination. It's probably 99% of those in the hospitals on COVID. It's really high. I mean, are unvaccinated. There's a few that are what would we call it? That are vaccinated that sometimes get a minor dosage of COVID, but that's not too much. It's out there, but everybody gets vaccinated. 100% don't die from COVID. They've got that statistic. You could anyway. That's out there. I just saw it today on CNN, and we don't have any problems like they have in Texas and Florida by hospitals getting all jammed up. And if they get jammed up, that's for everybody. It's just not COVID-19 people. It's everybody. A car accident, a stroke, a heart attack, everything. We just want to get our hospitals jammed up, and here in Illinois and around Aurora here. So, Sonny, I'm glad you're with me today so we can discuss these things very briefly. You want to give us a little update? What's happening there at the VNA and things on that line?
Sure. Yeah. Again, John, thanks for having me back on your program. We're trying to coordinate a lot of our vaccination clinics with back to school events. So, as you may know, VNA has a health center at East Aurora High School. So we've been working with them to provide vaccinations for the students and their parents, etc. So we're there this weekend today. We're also working in West Chicago with a back to school event as well. A lot of students are preparing to go back to school if they haven't started already. So again, it's an opportunity for us to provide some education, not only for the students, but their parents. And then on Sunday, we'll be at Martin Luther King Park here in Aurora to provide vaccinations in supporting Alderwoman Shakita Hart Burns and her MLK Fun Fest back to school event. So we'll be there with some giveaways. We'll actually have our mobile van there at this event to provide some vaccinations. So to your point earlier, we are unfortunately seeing an increase in positive COVID tests. And those that are being hospitalized throughout the country, a large percentage are those that have not been vaccinated. So yes, there are some people that have been vaccinated that have come down with COVID, but they are not anywhere near the risk that those folks that have not been vaccinated. So again, as we've talked about this several times in your program, please reach out. Let us know how we can help. We are getting involved again with a lot of these events in corresponding with back to school events. Our health centers are providing vaccinations and testing, and we're also doing what we refer to as off-site clinics, where we will set up a clinic at an employer group, at a church, at a school, to provide vaccinations on site for convenience, and also doing our fair share of homebound vaccinations for those that can't get to a school or get to one of the to a local Walgreens or a Walmart to get the vaccination. So we're doing our best to make it as easy as possible for folks to get access to the vaccine, whether it be at our health center, at an offsite location, at a back to school event, or in the home. So please reach out and let us know how we can help. There's still a lot of misinformation going out there, but one fact is true, that those folks that are coming back positive, COVID positive, many of those, 90+%, are those that have not received even first dose of vaccine.
Yeah, one dose. And you got a beautiful thing. Will just briefly touch base again on that, as about that homebound situation. You guys are one of the, well, maybe there's more out there, but there's not very many doing this homebound type of operation where you got a relative or someone, or you just have a hard time getting out, or maybe your loved one does. They'll come to you, and your operation is in several counties here, right? You're in Kane, DePage, and I forgot you're in another county. You're in the whole area, right? Quite a bit, right?
Yeah, we're in Kane, Kendall, Will, and DuPage. And yeah, to your point, John, we've been doing homebound vaccinations now since February, and surprisingly, there are many folks that have not received that first dose, and it's taxing for them to travel to a VNA health center or to see their PCP, whether they're a VNA patient or not. So we will bring that vaccine to them, vaccinate them in the comfort of their own home, and if they have a spouse or caregiver or children that are there as well, when we schedule that appointment, please let us know how many folks in the household need to get vaccinated, and we'll bring that. And again, all the services we're offering, there is no charge, there's no cost. We just want to do our best to make sure that our communities are safe, and members of our communities, families are safe. So yeah, we've seen, and we receive a lot of referrals from the hospitals in our area, from Northwestern Medicine, from Rush Copley, from Amita, a lot of our hospital partners. So again, it is surprising that every week we're getting lists of patients that need to be vaccinated because they've been waiting on, lists. They've been waiting for months to get into another vaccination clinic, but unfortunately, things kind of, they have been forgotten. So again, we're glad to partner with the Kane County Health Department, DuPage County Health Department, and they are, and many of the senior services organizations throughout our service area. They're referring patients to us on a daily, weekly basis, and then we will deploy our RNs and or nurse practitioners to provide the vaccine in the home setting.
It's very good, Sonny. I'm going to offshoot one thing here. How are the healthcare people holding up? Are some of these areas in the South, I know they're having nursing problems and just exhaustion. How are your people holding up, would you say, Sonny?
Yeah, I think my hat's off to all the providers, VNA and non-VNA providers out there that are on the front line. It's a very stressful and taxing time. I mean, we started to see a lull in the spread of the vaccine, and now in the spread of COVID, and now we're starting to see an uptick, unfortunately, over the last few weeks. So it is very taxing to them. And many are being called to work after hours to manage our clinics. They're asked to work on weekends, and I cannot say enough for our teammates at the VNA. And again, I know there are many other folks that are not part of our organization that are doing the exact same thing. So I know it's a very stressful time, not only for our frontline providers, but also taxing for their families as well. But I cannot say enough for the great work that they're doing when they too are tired and stressed and have families as well to care for and support. But they continue to do a fantastic job in getting out there, and whether it be at the health center or at an offsite clinic or even in someone's home. To your point earlier, there aren't many groups now that are continuing still to provide homebound vaccinations. So kudos to our RNs and NPs that are traveling and driving, and kind of many times they're just on their own, and just it's the nurse and the vaccine and going to someone's home and providing that vaccination for the individual and or their caregivers. But yeah, we're doing our best during a very challenging, stressful time, and our folks are doing whatever they can to maintain some semblance of a work life.
I know.
So
We got to be supportive, prayerful of these workers. And I know, like in Texas, they brought up that's just an example of they're down 2,500 or something nurses or something. I mean, it can happen to any of our areas if it just gets overwhelming, and we don't want that. That's why we're doing VNA is getting out there and trying to get those clinics and vaccinations with people. Either come to the VNA or do these off-site type of vaccinations. Now, tomorrow we have a special vaccination at East School. That's on Tomcat Lane, and that's from 10 to 1. And Sonny, what type of documentation or things that they should be bringing when they do those, when they come to our vaccination clinic, your vaccination clinics?
Sure. So at times we're asked they pre-register, and other times we just take walk-ins. So no need to bring documentation. If they have a driver's license, that's great. But all we ask is, so in this example, we'll do the second dose at our Aurora Highland location. So they'll already have a scheduled second dose time and date at our Highland Health Center, John. So all we ask is, at the end of the day, pretty much we ask for basic information: name, address, phone number, date of birth. It's pretty simple. Not a lot of, there'll be some consents that our team will hand out. Want to make sure that we ask some medical questions and make sure everything is okay. And then once the vaccine is administered, we'll ask them to stay with us for about 15 or 30 minutes, depending on how they answer the medical questions, just to make sure everything's okay, no side effects. But we don't ask them to bring any documentation. I think that's one of the opportunities we have here, is that a lot of folks perhaps are concerned. What documentation do I need to bring? Do I need to bring official paperwork, etc.? Absolutely not. Absolutely not.
Is that a little different though for children? We got to prove their age, though. Maybe
prove their age. That's why for those that are of not of age, we want the parent, right, to be there, their guardian to attend with them. So in that case, the parent has to consent, right, for the a 13-year-old's vaccine. But the parents are usually there with them, so that's not usually not typically a problem that we're facing when we're vaccinating.
Okay, and the children and everybody at this vaccination, I assume you're going to be doing Pfizer, maybe?
Pfizer, yes, Pfizer. So we'll do the first dose at the event tomorrow, and then the second dose will take place at 400 North Highland, which is one of
Highland
the
location
in Aurora.
And that's about, what, 3 weeks or something?
Yeah, it's 21, 22 days. So 22nd day, we will schedule. And when they come out for the first dose tomorrow, they'll already have a set date and time for that second dose.
Well, that's very good. So everything's very convenient. I think we got on your sheet here, the second dose is September 5th.
There you
5th of September. And so we want to get everybody to get their doses. If you're in the community in the east side, you can come up tomorrow for that, or go Sunday to the park there and MLK Park and get your vaccinations. And we'll have more information. But of course, you can always go right to the VNA, right to their site and their home there, and get those vaccinations too, and online or at home with the homebound. So we got several ways to get vaccinations, and of course, there's clinics at vaccinations at pharmacies, most of them, I think, in the area. So, and the county has some sites too. So we got the places. Let's just get the vaccinations. Sonny, you think of any thoughts last of what are some of the I don't know, what have you heard out there that really are people slow on this? What are some of the arguments that you've heard, and I'm sure you can debunk those, but what's what's slowing these people down quite a bit, would you say, on getting the vaccinations?
One thing that we've heard, and we had a meeting with some of the leaders in one of our advisory board meetings earlier in the week, John. So thanks for that. That was a nice segue to what my information here is, that there are many folks that, because of when they work or where they work, they're afraid to miss work. Maybe they work a morning shift or a late night shift when many of the vaccine centers are not open. But our thoughts are, if you're afraid to miss work, okay, that's one thing. But if you get COVID, you're going to miss some time. right? You're going to miss
Yeah,
some time.
that's
So we have,
correct.
that's why we have our drive-throughs open in the mornings at several of our health centers. And again, we're trying to make this as convenient as possible. And we can also provide the vaccine at an employer. So if you're part of a group and there are 5, 10, 15 of your fellow employees that are working the night shift or the early morning shift, let us know and we'll set up a clinic there so it's convenient for you before you start or after. And then, of course, as a third pathway, we have we can vaccinate in the home. So again, really, we're trying to make this as convenient as possible. The other concern I know we've heard is for females, they're concerned that it will cause infertility. And if you obviously that's a serious concern, and based on what is out there from the CDC and medical journals, please read up on that because that's not been founded. And I think, but when you have a lot of misinformation flying around, it becomes, right, perception becomes reality, right, John? So those are concerns that we have. Very serious concerns is obviously if you're concerned about what will go into your body, but you have a lot of experts that say that no, that's not the case. But again, don't take it from me. Get on, look up in the CDC guidelines and verify and ask some questions there. But I think the one that was surprising was the whole thing about missing work. If you get tested positive and you got to self quarantine for a couple of weeks, you're going to miss some work.
Or
Whether
else
it be
they
use license
cheat
DNA
on
or
it.
not,
Or
take
else they
advantage.
cheat on it and go to work and then give more people COVID.
Absolutely. It's
I saw some parent did that in a school, sent their COVID kid to school.
yeah.
Not good. Not
Yeah.
good. And I don't know how this is happening yet, Sonny, but briefly on that work thing. I thought President Biden said smaller operations, they were going to reimburse people to go off work to get shots. I don't know how that's
Yeah,
happening yet.
I don't want to provide any misinformation. I'm not sure
Right,
where
right.
that
I don't
is.
know where that's
Yeah.
at, but I've
Yeah.
heard about it that
Yeah.
was supposed to be out there, or states were maybe they're given the option to do it with the state monies or something.
Yeah.
But I thought that could be one. But like you said, there's a lot of opportunities to do that. Come there, they can come to you, you can come to their house, etc.
Yeah.
And one other thing about young people, what have you heard any? I got some young people that told me, one of them said I had it, and that was another one. One basically says, basically, I'm invincible, that type of thing. Have you heard some of that too, maybe?
Yeah, no. Unfortunately, no one is invincible with this. And you can look, if you just look at statistics, many of
Right,
the folks that are coming down COVID positive are now younger people. So this is
right,
not just something for those that are older, have multiple chronic conditions. You have a lot more younger people that are testing positive. So unfortunately, in this case, this is a global pandemic, and no one is immune to this. So that's why very respectful of the fact that people just don't want to get the vaccine for whatever reason. But
right.
if you are interested and don't know where to go, as you mentioned, please reach out. We can answer a lot of your questions for you and try to make it as convenient as possible for us to come there, go to your employer, or for you to come out to one of our health centers in the 4 counties that we serve.
Amen there. And I think they just come out in the last week or two or more that this COVID is an equal age opportunity it's leveled out. It's not the young people don't get it. They're getting it just as much as the adults. It's leveled out. It's everybody, the unvaccinated. If you're unvaccinated as a youth, you got just as much chance as an adult to get it. And because this variant is really bad news.
Yeah. And one thing I
So,
want to add too, John, is, obviously we've been front and center here for the last, 7+ months, 8 months in providing vaccinations. It's also noted that many of our folks that we're vaccinating, whether they are VNA patients or non-VNA patients, they have not seen their primary care physician in 1 or 2 years. So if you don't have a primary care physician, please let us know. We have health centers where, again, it isn't just about COVID. We're here to provide primary care. and we can bring primary care to you as well in the home setting through our house calls program. So this is the time to make sure that you are healthy, you get your vaccination, and just around the corner, we'll be focused then also on the flu shots and flu vaccines
I was going.
in the early part of September. So we're just waiting for that. So please get vaccinated. COVID, flu is more critical now than in years past. Get your flu vaccine, and please connect with your primary care physician, whether it's a VNA provider or another group. It's important for you to get those checkups. And I think over the last couple of years, of course, who want to go see a doctor during a global pandemic? You want to stay home and quarantine, but go in for your checkup. And again, if you don't have a primary care physician, please reach out to VNA, because we can also work in collaboration with your provider in the home or in our health center. But it's important for you to get that checkup.
Yeah, and so that's tomorrow. We have a clinic over at the East Aurora High School from 10 to 1 p.m. Tomcat Lane, and just come on over. You're 12 and up on that. Are you come out? Are you mostly coming out with the van, or is it just set up tent, or how you do that most of the time?
Yeah, we do both. The van, as you can imagine, is in great demand. So the van will actually be at the Martin Luther King Fun Fest
Okay,
on
there's
Sunday.
the van.
There
I
you
got
go.
a
Thanks for
picture
the
of it. Yeah.
lead in there. Yeah, so that'll be on Sunday. We very high demand for the mobile van. It's
I know you got several things going at the same time, and
exactly. But yeah, it'll be at the event on Sunday. It will not be, from what I recall, at East Aurora. But yeah, it's making its rounds all across Aurora and our neighboring towns.
Yeah. So remember the numbers down there at the bottom of the screen. We'll keep that going here for, I don't know. We'll just keep it going. And well, I want you to remember the VNA for the shots. We'll keep this going till this. Anyway, we'll keep it going. I don't want to say how long. I wish it was short. I wish it was. So anyway, that's the number to call at the bottom with the extension there to call, and the VNAhealth.com and /COVID. So, Sonny, I just want to thank you. I'm just going to say we're going to have a little show on Monday. Hopefully, we'll have a guest. I'm working on that right now. And that's Monday. So I just want to thank Sonny for coming by and visiting with us here a few moments. Sonny, you got any final thoughts? Did we? I think we covered pretty good here. Any thoughts you want to leave with us more?
No, John, I really appreciate your advocacy and support to help our community stay healthy. Really appreciate your guidance and making time for us to connect. So
Yeah,
again, reach out with any questions. It's always a pleasure to connect with you, John.
Okay, well, I think we had a good session here, a good time together, and I hope people out there will take heed of what we said. Several opportunities to get vaccinations, and tell their friends about how they can get vaccinated. If you're already vaccinated, let's get your friends vaccinated.
Absolutely.
So again, thank you, Sonny, for being with us today. And so all I'm going to say right now is God bless out there, and bye-bye, everybody, and we'll see you, Lord willing, on Monday. Bye-bye now. Have a great weekend, and remember these vaccination clinics. Bye-bye.
Take care, everyone. Bye. Thanks, John.
Bye-bye.